should start presenting.
Follow the start presentation টা একটু পরেও করতে পারো।
Got it.
Just introduction টা দিয়ে নি তারপরে start present করো।
Okay, আমি already click করে ফেলেছি।
ঠিক আছে, অসুবিধা হবে না।
বলছি অসুবিধা নেই।
আচ্ছা ঠিক আছে, তাহলে করে ফেলো।
ঠিক আছে তো? ঠিক আছে, ডাকশন স্টার্ট।
তুমি শুরু করবে তো?
না আমি শুরু করব, হয়ে গেছে আমার শুরু। তুই কর, আর কিছু নেই বলার।
আচ্ছা আচ্ছা। Good afternoon, respected guests, chairperson, delegates, colleagues, and participants. Welcome to the fourth session of the two-day international webinar on yoga, the holistic approach to physiological and psychological homeostasis. At the beginning of the session, I would like to announce that participants are requested to write down their queries in the YouTube chat box. We will be answering them at the end of each lecture. Thank you. This session will be chaired by Dr. Tuhin Shubhro Banerjee, Assistant Professor, Department of Physiology, ABN Sheel College, Kuch Bihar, West Bengal, and Dr. Nimai Chand Mashanto, Officer in Charge, Mohanpur Government College. The eminent delegates of this session are Dr. Pallab Sengupta, Dr. Shulagna Dotto, and Dr. Doipayan Sinha. Dr. Mashanto has been delayed due to some purpose. He has asked us and given permission for us to kindly start the session. So I would request our chairperson, Dr. Banerjee, to kindly initiate the session. Over to Dr. Banerjee. Please unmute yourself, sir.
Am I audible?
Yes, sir, you are audible.
Okay. Thank you, Dr. Mahapatra, for the introduction. Very good afternoon, respected patron, delegates, and participants. I express my sincerest gratitude to the patron and the officer in charge, Dr. Mashanto of Government General Degree College, Mohanpur, and the entire organizing committee for giving me the opportunity to chair this session. I'm extremely happy and proud to introduce the first eminent speaker of this session, Dr. Pallab Sengupta, whom I had the privilege of knowing personally since college days. He is not only an excellent academician, but also an acclaimed researcher. Dr. Pallab Sengupta is a senior lecturer in the Department of Physiology, Faculty of Medicine, Bioscience and Nursing, Masa University, Malaysia. Dr. Sengupta has published more than 100 research articles and several book chapters with current Scopus H index of 21. He has worked as head of physiology unit and assistant professor in Faculty of Medicine, Lincoln University College, Malaysia. Dr. Sengupta has pursued BSc Honors, MSc in Physiology, and PhD in Reproductive Endocrinology from University of Calcutta, India. During his PhD, he was awarded with the Young Scientist Award by the Physiological Society of India in 2012. He had started his teaching career as lecturer in the Department of Physiology, Vidyasagar College for Women, University of Calcutta. Till date, Dr. Sengupta has guided 12 research projects for Masters in Medical Sciences and MBBS programs. He is currently working with 4 research grants, including Fundamental Research Grant Scheme, FRGS, Research Grant from the Ministry of Education, MOE, Malaysia. He has received the highest research publication award of 2019 from Masa University, Malaysia. Dr. Sengupta has also pursued research internship in andrology from American Center for Reproductive Medicine, ACRM, Cleveland Clinic, USA, and presently is a research collaborator and international research mentor in the ACRM Cleveland Clinic, USA. Dr. Sengupta will be discussing on male reproductive health and mind-body bridging. Over to Dr. Sengupta. Please.
Thank you, Dr. Banerjee. Thank you for your kind introduction. I'd also like to thank the organizing committee of this webinar, especially my friend Dr. Prashanjit, my junior Dr. Dakshayani. We are really privileged to be invited in this international webinar. We are listening to many eminent speakers, experts in yoga for last 2 days. And we are actually getting enlightened by the information, by the information that the lecturer, the speakers are providing, they're delivering. So for me, what I'm going to discuss today, as Dr. Banerjee has already mentioned, it is about the male reproductive health and mind-body bridging. Okay. So is my screen visible to everyone?
Yes, sir, your screen is visible.
Okay, thank you so much. Okay, so first of all, I'd like to start with male reproductive health. What is actually meant by male reproductive health? Because this encompasses a broad spectrum of male reproductive functions and the other aspects, those are related to the overall well-being of a person, of a man. Okay, so before coming to the definition of the male reproductive health, I'd like to mention the formal definition of health, and that is given by World Health Organization in 2009. That is, health is more than absence of illness. It is just not the absence of illness. It is the complete state of physical, mental, and social well-being. Similarly, reproductive health, it is beyond the absence of reproductive diseases. It is a state of complete physical, mental, and social well-being, and it covers not only the reproductive functions, it also encompasses the part those are actually suffered by the men who are undergoing different treatments due to their reproductive disorders, leading to either subfertility or infertility. So male reproductive health is a complete scenario which actually covers the physical aspect, mental aspect, as well as the social aspect of that particular man. So if there is any abnormality in the male reproductive functioning, if there is any disorder in the male reproductive functioning, it may lead to either way of this abnormalities, either physical or mental or in the social well-being. So when generally these male reproductive disorders appear, it can appear anytime. It doesn't mean the male reproductive health doesn't mean that it will only appear in adult men or in middle-aged men, or in aged men. It can also happen before birth. The cause may also lie in the duration where that particular male child was not even born. How? Because of the genetic causes. The genetic factors, those are present in the gametes of the father or mother of that male child, could also lead to the development of male reproductive disorder in that man. So it can happen in any stage of our life. It can happen in during our fetal development. It can happen during our childhood, adolescence, adulthood, any phase. And if there is any problem, if there is any male reproductive disorder, it not only affects that particular human being, that particular man, it also affects the family, it also affects the entire society that is surrounding actually that particular human being. So it is going to affect the health status of that individual, the overall quality of life of that individual, his physical health, his mental health, as well as his social life. So it is not mandatory that this male reproductive disorder will always lead to infertility. It could lead to subfertility as well. So in my talk today, I will basically focus on all these aspects. We should not think that male reproductive disorder means it is always male infertility. But I will start with infertility to provide an idea that how fatal it is and how the males are contributing to this factor. So about 15% of the couples worldwide of reproductive age, they suffer from infertility. This 15% case, it could be either due to male factor or female factor. And out of this 15%, half is generally, about 50% is generally due to the male factor infertility. And out of this 50%, generally 30 to 80% cases of male infertility. In 30 to 80% cases of male infertility, the proper cause, the proper etiopathogenesis of male infertility is not known. It comes under the idiopathic type. However, there are several causes, several factors that can lead to male infertility or male subfertility, including the lifestyle factors, including the environmental, occupational factors. And as I was mentioning, there are different genetic factors involved as well, from that particular man or from the parents of that particular man. So all these factors may be in a single way or in combination, they can lead to male reproductive disorders. So here I have put some of the causes, as I was mentioning before. And this is from one of our articles published in 2017, that environmental, occupational, lifestyle causes, these are the common causes of common factors, those are actually affecting male reproductive functions. And other than the environmental, occupational, and lifestyle factors, if there is a primary pathology present in the male reproductive tract, it may also lead to subfertility. It may also lead to infertility. Other than the reproductive causes, the general systemic pathologies like diabetes, like thyroid disorder, cancer, or overall obesity, it can also impact on male reproductive functions. So all these causatives, what I have put up here, they work in two ways actually. One, the direct way, it affects through the direct way, it affects actually the reproductive tissues, reproductive organs. So the commonly presented mechanism of malreproductive cause, mechanism of malreproduction is actually by the generation of the oxidative stress and so many other things, which can lead to the death of the gamete or the supporting cells. Those actually help in the proper reproduction by that particular male, or through the indirect effect where these factors are actually they are uh, disrupting the neuroendocrine axis. They are disturbing the hormonal balance, and when this direct and indirect pathways come together, they create problem in the production of sperms, production of good quality sperms. Here I have shown only the count, but other than count, there are several factors involved like morphology, like motility, the volume of the overall volume of the semen, DNA integrity. So all these are, quite important to for a successful reproduction. So all these causatives, environmental, occupational, lifestyle factors, they either destroy the normal process of the sperm production, or they destroy the already produced sperms, they decrease the quality, or they affect the neuroendocrine axis, they disturb the neuroendocrine regulation of the male reproduction. So all these ways, they are either impacting directly the organ or indirectly the organ to reduce the semen quality. Systemic pathologies like diabetes, obesity, they also interfere in this axis, either directly or through other hormonal crosstalks, like with insulin or other adipokines, with cortisol, thyroid hormones. So when these hormones, they crosstalk with the reproductive hormones, in normal male, they actually regulate the normal reproductive function. But when there is any systemic abnormality, systemic pathology, the crosstalks, they got disrupted. And all this together, they ultimately result in either male subfertility or infertility. So these are the general causes of abnormalities and male reproductive functions. So how to manage it if there is anything, if there is any abnormalities in male reproductive function, if there is any male reproductive disorder, how to manage it? There are several ways already present. There are several methods already proposed involving lifestyle modifications, involving surgical approaches, non-surgical clinical approaches. If there is any infection, if there is any other abnormalities, there are non-surgical clinical managements as well. If these are working, it's fine. Otherwise, there are options for assisted reproductive technologies as well. So all these methods for the management of male reproductive disorders are already there. But the expenses and the after effects of all these treatments, sometimes these are not either bearable, or sometimes these are not fruitful to overcome this problem. So what the couples of present days, they are doing, they are turning towards some techniques, some medicines which are seems to be promising. So nowadays, the people, the couples, they are turning towards complementary and alternative medicine, and which are involving many things actually, starting from homeopathy, acupuncture, so many things. And it also involves yoga. But all other treatments, all other complementary and alternative medicines, those either target the organ or target the hormonal regulation. They are not like yoga, which actually integrates yoga, as we are already listening for last 2 days in different talks. Yoga, it integrates our mind. It integrates our mind with our body, with our soul. And by balancing all these, it gives us the proper health. So if we apply it for our reproductive health as well, this is one of the best recommended therapies, or in normal reproductive health, it is one of the uh, most effective practices that can either improve or maintain or enhance the male reproductive health. Yoga it has been a part of the health system in India for more than 7,000 years. People, they are practicing it, but nowadays, despite of the presence of several modern clinical and medical treatment options, yoga seems to be quite effective in the management of male reproductive disorders. So how yoga actually relevant, how it integrates our mind, body, and our male reproductive organs. I'm focusing basically these three parts: mind, body, and male reproductive organs, because we are discussing on the management of male reproductive disorders. So how these three things are integrated by yoga practice. As I told you, in the causes of male reproductive disorders, that the several causes, the numerous causes, those are affecting male reproductive tract, they either directly affect on the reproductive organ, or they affect the neuroendocrine axis. And if these two are already affected, the male will be suffering from any kind of reproductive disorder. And if the disorder is there, his mental health, his social health will be affected as well. So how the yoga practice controls mind first in this particular axis: mind, body, and male reproductive organs. Yoga, it impacts on hypothalamus and related regulatory areas. By controlling hypothalamus, it actually controls several aspects. It controls our autonomic function, it controls our endocrine function, it controls our temperature, which is quite important in the aspect of male gamete production, and all other regulatory areas, including our emotions. So yoga practice, it impacts on our hypothalamus, and by that it regulates all these. It also influences on our autonomic nervous system directly and indirectly. It regulates our stress response pathways. The stress response pathways, those are under the control of hypothalamus and other neural centers. It also influences our cognition and emotional areas on cerebral cortex and limbic system, because all these things are needed to maintain the proper male reproductive health. So yoga practice, regular yoga practice, is actually keeping our mind integrated and indirectly, that integrated mind can talk with the other parts of our body and male reproductive organs to keep the male reproductive health intact. What about the body? What about the other parts other than the male reproductive organs? It has its effect on somatic and visceral organs like heart, like adipose tissue, blood vessels, endothelium, where it regulate the circulation, where it regulate the hormonal release, where it regulate the adiposity. So it regulates those organs, and by regulating them, it is impacting on the reproductive health as well. It also regulates the immune pathways. Those may affect reproductive functioning, because when there is any infection there is a systemic infection or an infection in the reproductive tract, it either directly or indirectly affect the reproductive functioning. So yoga practice, it regulates the immunoregulatory pathways. And by that, it maintains the normal reproductive function. So these are indirect effects. What about the direct effect? It's already evident that yoga practice, it modulates the neuroendocrine immune pathways that help in the continuation, that help in the maintenance of the male reproductive function. It improves spermatogenesis, sperm production, and not only the production, the number, it also maintains the normal morphology, the genetic composition, the overall volume, motility, and other things to keep the semen quality intact. It decreases sperm DNA damage, because if there is a damage, a fragmentation in the sperm DNA or any other kind of damage in the sperm DNA, it may hamper the process of fertilization, or if it is not hampering the process, it may cause any kind of abnormality in the fetal development, including the infertility or subfertility in the male fetus in the next generation. So yoga is effective. Yoga is effective in decreasing the sperm DNA damage, telomerase attrition, reducing the oxidative stress, cellular aging, and all these things. Yoga also affects the local adiposity. Local adiposity means the adiposity in the reproductive organs and associated areas. By regulating the adiposity, it can control the immune reactions, it can control the temperature in the reproductive organs, it controls the vascularity, to keep the circulation proper to the reproductive organs, either to the testis or the accessory organs. It keeps the muscle functions intact, and it also improves the sexual functions through the natural intercourse. So the desire for sexual intercourse, the desire for reproduction, it is also maintained by all these integrated functions. So yoga actually integrates our mind, body with our reproductive organs by keeping all these things functional, or by improving their functionality to keep the male reproductive health proper. So these are some facts about the impact of yoga on male reproductive functions. As I told, it impacts both on neural and endocrine systems. Neural systems, I already mentioned, it impacts on hypothalamus, our emotional areas and limbic system. And through that, it controls several aspects of the neural regulation of the reproductive function. Yoga practice, it increases the frequency of the alpha wave. It decreases the serum cortisol level, the stress hormone level, which interferes in each and every part of the gonadal axis, hypothalamogonadal axis, that is regulating the male reproductive function. So yoga practice decreases serum cortisol level. That is evident in several studies. It improves our pineal secretion, melatonin secretion from pineal gland. That is another way of combating stress, oxidative stress. It is evident that the practice of Kundalini Yoga, it helps in the treatment of the prostate cancer and disorders those are related to prostate. It gives the relief from the blockage of the second chakra, the sacral chakra, which is concerned with our emotion, our creativity, our desire. So this, by regulating, by removing the blockage in the sacral chakra, yoga practice actually helps in the prostate health. Other than that, compression of the in postures such as yoga mudra, it also improves the blood supply to the prostate, improves the tone of the prostate. So it helps in getting relief from several disorders, including cancer in the prostate. Kapalbhati, it is an excellent practice that actually helps in the movement of the pelvis, and it gives relief from any kind of inflammatory reactions in the prostate, like prostatitis. It helps in the relief from any kind of inflammatory condition. And other than Kapalbhati, Dirgha Pranayama, Ujjayi Pranayama, all these also help in cooling down and relaxation of the pelvis region. And by that, it provides proper blood supply. It minimizes the probability of any kind of inflammation in the prostate. And it keeps the prostate health proper. Other than this, obesity, which I was mentioning before, it is one of the key contributors. Obesity impacts several organs, several male reproductive system in several ways, either to cause infertility or subfertility. Yoga practice, in several reports, it has been reported that it controls the adipokine levels in our blood, and that helps to withdraw the inhibitory functions of those adipokines over our reproductive hormones to improve the reproductive functions in a man. So here I have put one reference of yogic practice that is reported to improve serum adiponectin level and leptin level, along with serum lipids. Okay, so it helps in the improvement of male reproductive health. Those were actually disrupted by metabolic syndrome, including obesity. So this particular table I have put from one of our publications. It actually briefs the different yoga postures and their impact on different aspects which may affect male reproductive health: anxiety and stress, obesity, semen quality, prostate health, how these are actually impacting on the male reproductive health. So here I have put some information on it. So if we take yoga as a therapy of male reproductive disorders, Is it a valid therapy? Can we practice it together with the available therapies, including the medical, including the surgical, ART technologies? Can it be practiced together with that? Yes, it can. Because the main way the yoga acts on male reproductive system, as I already mentioned, it integrates the reproductive organs, their functioning with our other body functions and with our neural and endocrine regulation. So how the yoga therapy impact on male reproductive health? It actually subsides stress and anxiety, and it improves our mood and functioning. So stress, which is continuously play a role in male fertility and subfertility, can be minimized by yoga, because there is a continuous feedback. If somebody is suffering from lifestyle stress, it may contribute to subfertility. And if this person is suffering from subfertility or infertility, again, due to that subfertility, the stress will appear to that person. And that stress again will impact on his reproductive health. So it's a feedback. It's continuously, it works in a loop, and it deteriorates male reproductive health. So yoga is effective in reducing stress, lifestyle stress, psychological stress, to overcome all these problems, to mitigate all these things those are related to our lifestyle stress. The link between stress and infertility, the stress hormone cortisol, as I told already before, that regular yoga practice, it is already reported to decrease our serum cortisol level. Yoga practice also improves melatonin level. So all these endocrine regulations are there to also mitigate the stress-related impairment of male reproductive functions. If the patient is suffering from cancer, any kind of reproductive cancer, or HIV, or even infertility, so fertility or infertility, there is a huge burden of psychological stress that comes to that particular guy. So yoga practice, by integrating our mind, our body, and our soul, it gives us relief from that stress due to that particular element. So yoga practice is very much effective. It is quite proven in several publications, several research studies, that it is quite evident to subside stress and anxiety that may lead to reproductive disorders. It also improves mood and functioning. Studies have already proved that a regular yoga practice improves, it gives relief from stress, depression, anxiety. It also it gives relief from stress, anger. So all these emotional and behavioral aspects, those are also related either directly or indirectly to the male reproductive disorders. Yoga practice can minimize them. And thus, yoga is proven as one of the most effective therapies of male reproductive disorders. So who should actually practice yoga? Is yoga only for the adult men who are actually producing the gametes, sperms, who are actively participating in reproduction? Is it only meant for the men who are in their reproductive age? Or is it for everyone? Is it for a child as well? Is it applicable for the men who are in their teenage? So now we will discuss how the yoga practice can improve the male reproductive health or male reproductive functioning in each and every stage, life phase of a man. So if it is childhood or early adulthood, that time what happens? Yoga actually helps in the development of strength, endurance, grace, and it balances the life, because the man, that time it is entering uh, towards a new life, not only the reproductive life, but to the various aspects are going to open to him. So the development of strength, endurance, grace is quite important. And during that time, yoga practice can help that particular child or that particular teen to balance all these things and to improve his overall health, overall quality of life. This particular phase, early adulthood, it is also important because at this age, the reproductive growth actually starts, sexual maturation occurs. So this time yoga practice is quite important. And according to Hindu philosophy, if a person is having a healthy spine, he is able to balance, he is able to adequately balance his body and mind. So yoga practice can help us in that maintaining that balance. Yoga helps to develop chakras and balances it within body chemistry and to maintain that complex neuroendocrine orchestration. So the complex neuroendocrine immune crosstalk that's going to start at this particular life stage can be improved or can be properly balanced by yoga practice. It also improves the circulation to the reproductive tissues, reproductive organs for their proper development and for their proper functioning. For the development, the testes and all other accessory organs, their development is quite important. And for their proper functioning, their secretions, their functions in gamete production will also be improved by regular yoga practice. So after that, when the man enters in his adulthood, he should continue the practice of yoga to maintain his reproductive health. Yoga in adult men, it helps to promote circulation because, like in early adulthood as well, it continues. It helps in continuous development and growth and normal functioning of the reproductive organs. It promotes circulation to the primary and accessory reproductive organs to keep their functioning proper. It helps in the proper crosstalk of the neuroendocrine axis, which is quite important, which is necessary for the normal for the maintenance of reproductive function in a man. It mitigates the stress-related reproductive dysfunctions, as we were discussing before. It improves the male vitality and sexual energy. And here I have mentioned about some of the postures, like Mula Bandha. It is associated with the relief from spermatoria, the involuntary release ejaculation of the sperm, frequent and involuntary ejaculation of sperm. It can be, treated by regular practice of Mula Bandha, inguinal hernia, and also the proper production of testosterone. Can be restored by the practice of Mula Bandha. For the men who are practicing brahmacharya, Certain yoga, like Siddhasana, it helps in the reduction of the sexual desire. It helps to reduce their desire, to control their sexual desire, and to maintain their life. So yoga practice not only improves the reproductive functions, it not only surges the blood circulation to the reproductive organs, to the endocrine organs, to improve the male reproductive functions. It also helps to regulate, to keep the balance in adult men. So if there is a proper balance, the reproductive health will be intact. Because as we told before, reproductive health, male reproductive health, it is not only about the reproductive functions, it also encompasses some other aspects. Okay, so yoga practice in adult men gives us that capability to balance the reproductive function. What about the yoga practice in middle-aged men? In this particular age, what happens? The emphasis of yoga practice progressively it shifts from growing bones or muscles or developing the reproductive organs to protect health, to protect the function of either reproductive organs or the overall physiological systems. So in this particular age, the human being, that particular man, is not going to grow or develop the reproductive organs or their functions. He has to maintain the function. He has to maintain and protect his reproductive health. What is the key problem men suffer at this particular age is erectile dysfunction. So erectile dysfunction as well as loss of sexual attraction to the female partner. Why so? Because of the stress in the daily life stress, huge work pressure, sedentary lifestyle, less physical activity, obesity, disrupted lifestyle, smoking, alcohol consumption, so many other factors are there which are accumulating actually from his early adulthood to this particular age and on, which ultimately results in this kinds of reproductive abnormalities, including erectile dysfunctions, a reduction in sexual desire. So how this yoga practice, how the yoga practice can help? Yoga practice can improve as I was telling before, the mood and functioning of the individual. When the mood and functioning improves, that time his cortisol level that is already increased due to stress, his lifestyle stress, work stress will decrease. Yoga can increase the circulation to his reproductive organs to maintain their functions, not to grow further, to maintain their functions. And not only the reproductive organ related thing, in this particular age, the man may suffer from several other systemic diseases like diabetes, like cardiovascular diseases, high cholesterol. So those are also indirectly impacting on his reproductive functions and reducing his vitality. So how yoga actually improves? Yoga, it is not only meant for the reproductive functions. It, as we all know, it improves the overall health of an individual. So when the person is practicing yoga, by improving his overall quality of health, quality of life, his overall health, when he is minimizing his cardiovascular risks, when he is treating his diabetes, when he is reducing his blood cholesterol, indirectly, he is also helping his male reproductive organs, to function properly. So, in the middle-aged man, it is quite important not only to treat some reproductive disorders, to continue his normal reproductive functions. Because in this age, there are several lifestyle or occupation or his own problems which may interfere the reproductive functions. But yoga practice can help to overcome all these problems and to maintain his reproductive health intact. What about the aged man? Aging, it's a natural process. It in growing men and women. What happens at this particular age? All the hormonal levels, the neural regulation, the neural control over body, muscular activity, circulation, all they tend to decline. So if the overall health is tending to decrease, what happens? It will definitely impact on reproductive functions as well. So this decrease in the overall physiological function, along with the pathological conditions, those appear in this particular phase of life in an aged man, that also interferes the reproductive function. So yoga practice in this particular age is also quite important. This is not important for further reproduction. This is not for the fertilization. This is to keep his hormonal levels intact. In an aged man, it is quite important to keep his circulatory system intact, his immune system intact, and his endocrine system intact. So whenever he is practicing yoga, he is actually pushing those systems to perform in a better way. And by regulating his overall health, he is maintaining his hormonal levels and he is avoiding those problems. Those are related to hormonal disbalance, mental disturbances. So yoga in this age, in an aged man, can also help in these ways. So as we have discussed, yoga practice is not only needed for an adult man, it is needed in each and every stage of a man, not only to keep his reproductive functions proper, also to improve his overall health, to improve his overall quality of life. So here I have put in last two slides of my talk, I have put some of the yoga postures. I'm not going to discuss all these things in detail, but this yoga postures, they, as I was telling in the slide where I was mentioning about the mind, body, and male reproductive organ crosstalk, these yoga postures improve circulation to the reproductive organs. These yoga postures, they help in the maintaining of the muscle tone in those organs. These yoga postures help in the proper functioning of the neuroendocrine system of a man. So all these actually in an integrated manner, they help in the maintenance of overall male reproductive functions. And beyond the reproductive function, if somebody is suffering from subfertility, the yoga practice will help in reducing stress, in improving his mood, to overcome those conditions, to improve the quality of life. So when there is no stress, when there is less stress, these reproduction related problems, these hormone related problems will disappear. And that will indirectly help in the maintenance, in the regulation of the overall reproductive health of a man. So that's all from my side. I would like to thank again the organizing committee providing me this opportunity to talk on the male reproductive health and impact of yoga on it. Thank you so much.
Excellent lecture, Dr. Sengupta. Thank you for bridging the mind with the reproductive health through the application of yoga, and thus bringing out the implication and importance of yoga in the physiological well-being. Now I request Dr. Mahapatra to kindly put forward the questions. Over to Dr. Mahapatra.
Thank you, sir. Thank you, Dr. Sengupta, for your wonderful, lucid lecture,
Thank
enlightening
you.
the help of yoga in the male reproductive functioning. We have received a single question relating to the involvement of mood and upliftment of mood and its effect on reproductivity. The question is, how is mood affecting the reproductivity and lifestyle?
Okay, how the mood is related to reproductive functions and lifestyle.
Yes.
Okay, so if somebody who is suffering from extreme stress, either due to his work pressure or due to any other lifestyle factors, what it actually causes, it disrupts all the crosstalks, between among his hormones, not only his reproductive hormones, and also with the other metabolic hormones. And if the hormonal regulation, those are regulating our reproductive functions, are disrupted, definitely the functioning of the reproductive organs will decline. So proper regulation, proper maintenance of the mood is quite important to maintain the chemical balance. As I was telling before, the neuroendocrine orchestration that maintains our health, that maintains our reproductive function, those are quite needed for in each and every step of a successful reproduction. So if the mood is not well of that man, it disrupts the neuroendocrine orchestration and affects the reproductive function. So by practicing yoga, we can maintain our chemical balance intact, and in the other way, we can maintain our normal reproductive functions. Thank you so much.
Thank you, sir. I request Dr. Mashanto to kindly introduce our next speaker.
Very good afternoon, everybody. Our next speaker, Dr. Sulogna Dotto. Dr. Dotto is a lecturer in physiology and research coordinator, Faculty of Dentistry, Masha University, Malaysia. Dr. Dotto has published more than 55 research articles and several book chapters with current Scopus H index of 12. She obtained her BSc honors and MSc in physiology with specialization in immunology with third rank in the University of Calcutta, India. She had qualified the national eligibility test by UGC CSIR in June 2011 and earned her PhD in the field of immunology with this university and University Research Fellowship, India. She started her career in teaching as a lecturer for postgraduate program in the Department of Physiology, Srirampur College, Calcutta University. She continued her research and teaching career in Malaysia, joining as a lecturer in physiology and coordinator in biomedical science, Faculty of Medicine, Lincoln University, University College. She had supervised several research projects for masters in medical science program. She is currently working with three Massa University internal research grants and a fundamental research grant scheme from the Ministry of Education, Malaysia. Dr. Dotto has pursued research internship in andrology from the American Center for Reproductive Medicine, Cleveland Clinic, USA, and presently is a research collaborator and international research mentor in the ACRM, Cleveland Clinic, USA. Dr. Dotto will be our lecture on yoga and pregnancy, a neuroimmunoendocrine tale. So over to Dr. Dotto, please.
Thank you very much, sir, for the kind introduction. It is my pleasure to be here. And since yesterday, we are listening to many enriching lectures on yoga, and we are really enlightened. And being a researcher in reproductive physiology and immunology, it is really our pleasure to get so much insights in yoga in this particular webinar. So thank you for inviting me once again. So I'd like to present now. So today I'm going to discuss on the topic yoga and pregnancy, a neuroimmune endocrine tale. So I'm Dr. Shubhavna Datta, a physiology lecturer from Asa University, Malaysia. So to start with, pregnancy itself is a mystery. Whenever a baby, whenever a child asks his or her mother that, Mom, how does baby come from? So the tale, the usual tale that the parents tell is that the babies come from sky. They are brought, they are delivered by the merciful white storks. So I think, that particular story, or there are lots of stories like that, those are more convenient to believe and more convenient to understand compared to what the actual scenario is. Like it is a mystery how a woman's body, how the immune system of a woman's body does not reject a semi-allogenic fetus, which is partially foreign to her body. So this definitely needs a physiological harmony. Like it needs the integration of all the physiological processes, like the neural, the endocrine, and the immunological modulation. These are all needed for a successful pregnancy to occur. Otherwise, any factors, among which the stress is the major one, can jeopardize the entire process, bringing to an undesired outcome. So there have been a lot of approaches that are put forth that how this all the process can be brought to a harmony and how that can be restored in present scenario where stress is playing such a huge role. So it has all started from our country, India, and then in all the westernized countries and all over the world, yoga is becoming very popular. It is a bliss to the pregnancy that can actually bring about the mind body breathing to bring about a successful pregnancy. So I would like to focus on what actually these endocrine immune modulations are during pregnancy. It is a huge tale, but to bring to project it in a short duration, I'd like to focus on the key mechanisms how the endocrine and immune crosstalk are brought about in pregnancy. So, the immune system of the mother has to shift from an inflammatory process to an anti-inflammatory process. And in a recent publication, we had described that pregnancy can be actually broken down into three phases according to the cytokines that can be found in the maternal body. What are the three phases? Those are the early phase is the inflammatory phase where the implantation is carried on. Then the entire pregnancy period is dominated by an anti-inflammatory phase. And then again during the parturition, we have this inflammatory reactions all over again. So, while considering the important phase that is the during the duration when the pregnancy is ongoing, in between the anti-inflammatory phase that is dominant by some key changes in the immune system. So, the most important changes are that the Th1 cytokines, that is the immune system that is dependent on the T helper 1 cell, those get shifted to Th2 cytokines. Why? Because the Th1 cytokines are actually pro inflammatory cytokines. And if the pro inflammatory cytokines are generated, that may be harmful to the fetus. That may even lead to a rejection of the fetus, considering it to be a antigenic substance. While Th1 dominant cytokines, those are anti-inflammatory cytokines. So those maintain an immunocompromised state in the maternal, the feto-maternal component, so that the fetus can conveniently grow in the maternal entity. What are the other things? The macrophages. The macrophages, we know they have a phagocytic function and antigen presenting function. So those are diminished. The majority of the macrophages, those are inflammatory. They are called the M1 macrophages. So those M1 macrophage population shifts to M2 macrophages. So most of the macrophages that are found in the uterus will be the M2 type of macrophages. Then comes the reduction in the count of the natural killer cells and the conventional T cell and B cell. Those are also inhibited. So as a whole, the inflammatory immune responses are diminished. And the striking factor is that the pregnancy hormones. So, what are the key pregnancy hormones? Those are actually progesterone, estrogen, and human chorionic gonadotropin, HCG. So, these are the key pregnancy hormones besides a vast array of other hormones and factors that play a role in pregnancy. So, these hormones can help in the recruitment of the immune cells, they can regulate its differentiation as well as bring about modulation of the immune cell function. They can either act directly by binding to its receptors, and surprisingly, the hormone receptors are actually found in the lymphocytes as well as in the innate immune cells. So, therefore, it is already proven that pregnancy hormones can act directly on the immune cells to modulate its functions, or they can also indirectly act by altering the levels of other substances, growth factors, cytokines, and then they can indirectly influence the secretory activity of the immune cells. So I would like to focus on the key immune modulation that is brought about in the pregnancy. This particular hypothesis we have published this year in International Reviews of Immunology of Impact Factor 4.5. So this particular hypothesis says that the regulatory B cells and regulatory T cells are the main role players that brings about the immune modulation in pregnancy. So the regulatory B cell and regulatory T cell is the proliferation of this is brought about by progesterone, estrogen, as well as by HCG. So the numbers of B cells and T cells increase significantly in terms of pregnancy. So the main purpose of regulatory B cells is to produce anti-inflammatory cytokine, that is IL-10. So what does this IL-10 do? The IL-10 will inhibit the uh, conventional T cell populations. So whenever there is inhibition of the conventional T cell population, that will inhibit the inflammatory cytokine release. So the cytotoxicity of the T cells will get reduced. Moreover, it will co-stimulate the Treg cells. The Treg cells will also be influenced by the hormones that I told already. So the T cells, together with B regulatory cells, they will again um, stop the maturation of the dendritic cells. So whenever a dendritic cell matures to activated dendritic cells, those can itself act as an antigen presenting cell, thus activating the immune responses against a particular antigen. So in this case, we do not want any immune reaction against the fetus. So we need to restrict these type of immune cells, specifically the macrophages and dendritic cells. So uh, we do not allow it to mature to the mature dendritic cells. So it will remain as immature, or what we call as a tolerogenic dendritic cell. Then comes the innate immune responses, like the basophils, eosinophils, mast cells. These, whenever they migrate to the fetal-maternal components, immediately the hormones come into play, as well as the IL-10 and TGF beta that is being emanated by the B regulatory cells and T regulatory cells will inhibit this. So both the adaptive immune response and the innate immune response will come into halt, so that the fetal component can grow and develop in a robust way. So the role of progesterone is actually to induce the progesterone-induced blocking factor, so PIBF. The progesterone-induced blocking factor, what it does, it stimulates the production of Th2-dependent cytokines, those are anti-inflammatory. It also helps in the shifting of the Th1 to Th2 immune response. It helps in the polarization of the macrophage population from the M1 that is inflammatory to M2 that is anti-inflammatory. It also suppresses the toll-like receptors. Those are the innate immune receptors. Whenever toll-like receptors are activated, immediately the innate immune responses begin. So it helps to suppress the TLRS. Also, it helps in the asymmetric antibody production. Now, asymmetric antibodies are the antibodies which have less specification to the antigen. So it is quite obvious that if our body is the maternal body, produces the normal antibodies, those will specifically bind to the fetal component and destroy it, thinking that it is an antigen. So the purpose of asymmetric antibody production is that they have lower specification. So they won't attack the fetal component, but besides that, they also provide immune protection to certain extent only. So any invading bacteria, pathogens, or other microbes will get nullified to certain extent by the presence of the asymmetric antibody. The estrogen receptors are found in both the B cells and T cells. They activate the regulatory T cell and T cell. They also help in the shifting of Th1 to Th2, and it also helps in the activation of tolerogenic species and restricts its maturation to the uh, active dendritic cells. Then the HCG. The HCG, the HCG actually is the key hormone that keeps the level of progesterone and estrogen stable during the pregnancy tenure, and also it activates the B regulatory and T regulatory cells. The HCG, besides the HCG receptors, it can also bind to the LH receptors and helps in the activation of the regulatory cells. And HCG can also act as a substance which helps in the migration of the formed T regulatory cells towards the fetal component. So, in that way, the pregnancy hormone mediates the immune changes that are brought about in pregnancy. So, we can understand how complicated the state of pregnancy is when, in one direction, the endocrine axis uh, regulates to maintain the hormonal flow during the pregnancy, to maintain the steady levels of progesterone, estrogen, HCG, besides other hormones. And on the other side, there is a random change in the immune system that is supported by the hormones. So there is a balanced crosstalk between the hormones and the immune system. Now I come at the molecular level, what happens? So here in the left hand side, we have what happens to the innate immune response and how the hormones bind to specific innate immune cells. For example, this mast cell, whenever it's in the periphery and then it comes to the fetal maternal interface, so the progesterone and the estrogen they bind to it and leads to its inactivation. Similarly, the macrophages, in this one, the estrogen comes and binds to its cytosolic receptor and blocks its activation. Moreover, here we can see the dendritic cell, which is in the immature, in its tolerogenic phase. Here, all the hormones can come and bind to, including the progesterone that goes straight away into the nucleus and actually can also function as a transcription factor. Then estrogen that binds to cytosolic receptor, and on the membrane we have this human chorionic gonadotropin receptor or LH receptor where the HCG can bind to. So the actions of all these hormones lead to its inactivation and it does not get transformed into an activated dendritic cell. Then comes the NK cells, the uterine NK cells. These also the same thing. The NK cells are not activated because of the action of the progesterone and the HCG goes and binds to the mannose binding receptor over here. So in this way, the NK cells are also prohibited from getting activated. So this is all about the innate immune system. And from the view of adaptive immune cells, we see that these are the regulatory T cells that are getting activated by the HCG. So whenever they come in the fetal maternal interface, they are getting activated both by the HCG, the estrogen, and the progesterone, and they will block the conventional T cells from producing inflammatory reactions. So, and these are also B cells which are getting activated, which are getting inactivated, and the regulatory B cells, they will produce the IL-10, that is the anti-inflammatory cytokine, and besides that, they will also produce the asymmetric antibodies. So the innate immune response is reduced and the adaptive immune response is modulated. So this way, the pregnancy hormones mediate the immune balance during pregnancy. So, stress is one of the major factors that can breach into this intricate interaction between the endocrine and immune system and bring about the disruption of the physiological homeostasis that is brought about in pregnancy. So, whenever this breaching occurs, then there is either termination of pregnancy or there is a lot of complications that come into play to stress the mother. So, as also previous lecture, in the previous speech, Dr. Sengupta was also saying that the stress and reproductive system, they work in a loop. That is, once there is stress, it will impact the reproductive system, and impairment of reproductive system will again generate stress. So this way, the integrate balance between the physiological processes will get disrupted. So first, in 1964, Solomon has demonstrated that there is an influence of stress on immune response in animals and human beings. So he has showed that if there is a lesion in the central nervous system, so which corresponds to stress that affects the thymus-derived T lymphocytes, and it also can impair the cell-cell interaction that leads to the emanation of the cytokines and other immune factors. The stress effects on the immune system in various complex network of signals, and those are definitely bidirectional. That is, in a bidirectional way. And who are the mediators between stress and immune function? They are the nervous system, endocrine system of the endocrine system and the neural networks. So during pregnancy, what happens if there is stress, then it will affect not only the endocrine axis, but as we have already discussed that endocrine and immune responses are interlinked, they will disrupt all. So let's have a look on the mechanism by which stress can act during pregnancy. So whenever there is a stress, it's in physiology, we have all come across that stress actually activates the maternal HPA axis, that is hypothalamic pituitary adrenal axis. So whenever the HPA axis is activated, it will lead to release of ACTH, and that will lead to release of cortisol from the adrenal gland. So this cortisol actually affect every step of the hypothalamic pituitary gonadal axis. So how it affects, like the cortisol can directly affect the hypothalamus and lead to reduction of the gonadotropin releasing hormone. It can act directly on the anterior pituitary and cause reduction in the luteinizing hormone and follicle stimulating hormone. And as it is also can be perceived that through the reduction of GnRH, also the gonadotropic hormones are reduced. That is, LH and FSH are by default reduced. And then it can also directly affect on the ovaries and can impair the production of estrogen and progesterone. So, in this way, the stress can impact on the HPG axis. And whenever there is stress, we need to produce a lot of cortisol because that's what the stress is dictating the HP axis to do. So, from where the cortisol will get synthesized. So, we have a particular reservoir of the substrates through which the cortisol can be produced. To fast pace its production, some of the progesterones are actually considered as substrates to produce cortisol. So in that case, again, in another mechanism, that is whenever progesterone acts as a substrate to produce more cortisol, then definitely there will be reduction in progesterone. So the progesterone reduction is brought about by two distinct mechanisms. One, by suppressing the HPG axis, and another one by the usage of the progesterone as substrate to produce cortisol. So now, in a stress condition, as we are saying, the hypothalamus will produce CRH. The CRH can go to the fetal compartment and can affect the fetal HP axis. Moreover, the cortisol can also reach the fetal HP axis to disrupt the fetal HP axis. So there will be an increase in DHAS as well as estrogen concentration in the fetal compartment. And that will lead to impairment of the immunomodulation that is brought about in the maternal fetal compartments. And there will be increase in the pro-inflammatory mediators like more of inflammatory cytokines like TNF alpha, IFN gamma, all these things. And also the mechanical effect is the stimulation to the uterine smooth muscles to contract. So all these things will bring about an undesired pregnancy outcome. So now comes that what approach can be taken to mitigate stress so that this intricate balance between the neuroendocrine immune system is restored during pregnancy or maintained during pregnancy. So, yoga has a significant ameliorating effect on the autonomic, endocrine, and psychological alterations that is induced by stress. So, the noradrenergic sympathetic nerve fibers that come from the CNS and it supplies to both the primary and secondary lymphoid organs as well as to the neighboring immune cells. So this shows that CNS has direct effect on the immune functions. Also, together with HPA axis, the catecholamines can regulate a variety of immune functions that includes the cell proliferation, the cytokine and antibody production, the cytolytic activity, as well as immune cell trafficking. That is movement of the immune cells from the systemic compartments to the fetal compartments. Then the most obvious effect of stress-induced epinephrine or norepinephrine is the establishment of the sympathetic reactions, that is fight or flight reaction. So what yoga practice does is uh, actually the down regulation of the sympathetic actions and the activation of the parasympathetic actions. There are many studies on pregnant women that is being performed where the relation between stress and yoga has been shown. Most of them has shown that there is an obvious reduction in the sympathetic actions. But still now, the belief that parasympathetic nervous system is stimulated by yoga is on the research basis is still not very clear that how it leads to the activation of parasympathetic nervous system. But the restorative, the cooling effect of yoga that to maintain the physiological homeostasis is thought to be partially on the effect of the yoga to ameliorate the parasympathetic nervous system. So, if the sympathetic adrenal medullary axis is chronically activated by a chronic stress, then these molecules can have the capability of dysregulating the immune functions. And yoga, it most probably acts through the cerebrocortical limbic pathways on the hypothalamus to restore both the autonomic nervous system as well as emotional aspects so as to restore the physiological conditions. So, through various studies, it can be put forth that yoga actually acts on the paraventricular nuclei of hypothalamus to regulate the HPG axis. So, the paraventricular nuclei of hypothalamus, it leads to both the HPA axis and the HPG axis. So here, when we talk about the HPA axis, yoga can act on the paraventricular nuclei of hypothalamus, thereby inhibiting it. If the PVN is inhibited, there will be less ACTH that will be act the adrenocorticotropic hormone that will act on the anterior pituitary. If there is no stimuli to anterior pituitary, the corticotropic releasing hormone level will drop. So the adrenal cannot release much cortisol, and so the cortisol cannot go to the fetal compartment to increase the level of DHEAs from the fetus. So in that way, the stress response, the stress axis can be inhibited. So here, by the reddish color, I mean that it gets inhibited by a regular practice of yoga. So just like the PVN of hypothalamus, the posterior hypothalamus also is getting inhibited by regular yoga practice. So what happens by this? The sympathetic nervous system is inhibited and parasympathetic nervous system is activated. So that's how yoga brings about restoration. Thus, the levels of pregnancy hormones are maintained. The anti-inflammatory state brought about by the endocrine immune regulation is restored. There is emotional stability, as previously I told that yoga also acts on the limbic system, and there is overall physiological homeostasis that that a pregnant woman will experience. So, by restoration of psychoendoimmune state, a blissful pregnancy is gifted. So, yoga actually brings about this mind-body bridging. So, according to the studies and according to the researchers who are solely into yoga, we know that the most performed practices of Hatha Yoga are physical postures, that is asanas, breathing exercises, that is pranayama, and meditation, that is dhyana. So asanas are physical postures which stretch and strengthen different parts of body that brings about a massaging and circulatory boost to the circulatory system, and thus it rejuvenates the internal organs, the nervous system. It brings about a lubricating effect on the joints, muscles, ligaments, and also some asanas are also stimulatory to the nervous system, and as I told, also the circulatory system. Most importantly, they integrate the thought processes and the physiological functioning. So there is a mind-body bridging. Pranayama, it consists of a variety of techniques that actually regulates our breathing, and it is usually means if it is slower, regular, and more refined, so the benefit is more. So So the ultimate aim of all these practices are to prepare the body to achieve a state of tranquility so that the mind is peaceful and there is proper integration of all the systems in our body. So I'll be showing some yoga poses that are recommended for pregnant women. For example, in first trimester, the heart opening poses as well as the Uttasana, it can also be supported one, and Vikrasana. These are helpful in boosting the circulation, respiration, a nervous coordination, as well as strengthening of the thighs, shoulders, chest, and also helps in the calming down of the mind. Then, in the second trimester, the asanas that are recommended, that is to energize the body and also to promote a healthy digestive system, a strong abdominal muscle, and to relieve any abdominal pressure or any discomforts. So for that one, the this one, the Prasiddha Pradoshana, this one can be supported because in pregnancy, the real one can be avoided. That's what is recommended. And also apart from there, we have the Viparit Karani. Viparit Karani can also be supported apart from the real one, that is, it can be supported on a wall. Apart from the real one, that is without any supports to the legs, and there can be Maulashana. So all these things can energize the body and to promote the lower abdominal health. Then in the final trimester, the restorative yoga poses, they lead to conservation of energy because the woman is going to face the pain of parturition. So it will help in the endurance of that pain and give her enough strength to combat the labor surges. So for that reason, it can be a Upavishta Konasana that can be supported with the help of a chair or something like that. Then it can be Baddha Konasana, and it can also be the Balashana or the child pose. So all these things will help the proper restoration and a proper bridging of the mind and body so that all the systems, like I have detailed the mechanism by which endocrine and immune system are integrated to maintain a proper robust pregnancy. So all this system can operate in line with the pregnancy trimesters. So to maintain that, yoga is very important. So with this note, I would like to thank and conclude my session. Thank you.
Thank you, Dr. Datta, for your beautiful and lucid explanation on the role of yoga, that is benefits of yoga on pregnancy. Is very useful to our society. So you have focused many cornerstone ideas relating to immunoendocrine status during pregnancy, and this is the correlating activity is highly necessary for a better outcome of blissful pregnancy. Your study would be helpful to society, which has no harm to the mother and baby, as well as very much cost effective, obviously. So again, I convey my profound appreciation and greetings to you for your socially useful study, as well as your dazzling and clear information to us. It is very much useful to our society.
Thank you, sir.
Over to Dr. Mohapatro. Is there any questions?
Yes, sir. Thank you, sir. Dr. Dotto, with your due permission, I would like to put forward a question that has been come from the audience.
Sure. Yes.
How stress affects FSH level in the uterus?
Okay. So, as I've already told, that stress actually affects the HPG, the stress actually activates the HPA axis to produce more cortisol, and cortisol helps in the cortisol actually affects each and every level of the HPG axis. So definitely by reduction of GnRH as well as by reduction of by the direct action of the cortisol on the anterior pituitary, the FSH level can drop. So in the both ways, either by inhibiting the GnRH as well as on direct action on anterior pituitary, it can lead to reduction of FSH. Thank you.
Thank you, Dr. Dotto.
Any questions more?
No, sir, there are no more questions.
Okay, okay. Many
Thank
thanks to
you.
Dr. Dr.
Thank you.
Okay. So our next speaker, is Dr. Doipayan Sinha. Dr. Sinha is presently Assistant Professor, Department of Botany, Government General Degree College, Mohanpur, Paschim Medinipur, West Bengal. He has completed his post-graduation from University of Delhi and doctoral degree from CSIR, Indian Institute of Toxicology Research and Department of Botany, Lucknow University. His research interests spans around the entire field of exploration of phytodiversity, ethnobotany, and so on. He has several publications in esteemed journal and national and international journals. Dr. Sinha will talk on yoga and Ayurveda, the two sisters of healthy and disease-free life. I would like to add something that Dr. Sinha is my keen colleague. He is a good orator. His lecture is very much interesting and attractive, but I am very sorry to say that we are running sometime lags. So I like to request Dr. Sinha to uh, put your lecture in a time-bound schedule, please. Over to Dr. Sinha.
Dr. Sinha?
Dr. Sinha, please.
Hello.
Yeah.
Hello, sir. Am I audible?
Yes, you are audible but not visible.
Okay, okay. Just wait a minute. Actually, the network is being problematic.
Yes,
So,
now visible.
anyway,
Now visible.
am I visible now?
Yes. You are visible and audible both.
Shall I start sharing my presentation,
Yes.
though?
Yes.
Okay.
You may, please.
Okay, 1 minute, sir. 1 minute. Sir, is it sharing now? I
Yes.
think so. Is it sharing now, sir?
Yes.
Hello.
Yes. You may start.
So
sir.
I start with my lecture. Okay, so I start off with my lecture. First of all, I would like to thank Honorable Officer in Charge, Government General Degree College, Mohanpur, Paschim Medinipur, for providing me a scope to deliver some of my thoughts and informations in this wonderful platform. I would also like to thank the organizing secretary as well as the convener of the mega event that has been happening since last 2 days for also providing me the scope, and my good wishes to all of them. And finally, my good evening to all the viewers and the audience. So today I'm going to talk on the yoga and Ayurveda, the two sisters of a healthy and disease-free life. Though, as mentioned by our honorable sir, that the time is a bit limiting factor, so I would like to skip up some of the slides to make it more fast. Anyway, so I wish to divide the lectures into a number of parts. So this yoga and Ayurveda, they are very intricately related to one another.
Sorry
So
to
before
interrupt.
going-
Sorry to interrupt, Dr. Sinha. Your slides are not visible yet.
My slides are not visible. Anyway,
No, sir.
oh my God, the sharing option is not activated here. 1 minute, please. Present now the entire screen. That's quite unusual. The sharing, you're not visible. The slides are not visible now.
No, sir.
If you can kindly guide me up, there's a pop-up there where the sharing option is.
You have to select
Sir,
first
please.
the screen. Please select the screen. You have to select the screen. Whether you want entire screen or other screen, you have to select first.
Okay, and I selected this entire screen, but
Then share option will come.
okay, now is it sharing?
Yes.
Yes.
Now. Now it is sharing. Yeah.
Yes.
Yeah.
So now the slides are visible, right?
Yes. Slides are visible. Move on.
Okay, so these yoga and Ayurveda are very intricately related to one another. So I would like to divide the lecture into a number of segments. First, briefly, I wish to discuss about the historical aspects of both yoga and Ayurveda one by one, very briefly, and then I would try to relate one with another. That's a bit difficult because though I am not directly linked to yoga or physiology, basically I'm a botanist and have some interest in Ayurveda and medicinal plant, but still I will do my best so that my lecture becomes decipherable. So I go on with the first slide. So what is Ayurveda? This Ayu means life and Veda is science. It's composed of two parts. The concept of Ayurveda is pretty old. It's somewhat developed between 2,500 years and ago to 500 BC, and then onwards it became transmitted one after another throughout the generation. And so far as yoga is concerned, it is believed to develop from the Indus-Sravasti civilization in North India, so that is also around 5,000 years ago. So both are pretty old, and we can say this yoga is a bit more older, but they have been simultaneously developing some thousands of years back. Okay, the next is, it was the first mention of the yoga was mentioned in the Rig Vedas, and later on it was developed by the Brahmins, who later on made it a practice, and their practice was again mentioned in the Upanishads. So the Brahmins were the forerunners of the yogas. And next, as the yoga spread throughout the continent, in the 3rd century, it was popularized in Jain religions and Buddhist religion, and especially with respect to the Mahayana Buddhism, where you find that the term Yogacara, and that means that they have been practicing yoga for a clean mind, for a noble soul, and for a noble cause. Okay, so Yogacara is a tradition of Buddhist philosophy and psychology, and emphasizing on mind and cognition, perception, and consciousness. All are directly linked to the mind, so that you can be a stable person, a positive person. Okay, and as we proceed, the yoga in the 5th century were somewhat more religious. It was meant for meditation and religious use. And till then onward, it was basically a domain of the Brahmins or the supreme religious preachers or religious leaders, they all practice yogas. Okay, and in the first set of yogas, they consisted of 4 subcategories. That is to demarcate the cause of suffering by practicing yoga to search what is the cause of suffering. The second one is boosting consciousness. The third one is achieving transcendence. And the fourth one is a mystery. What is mystery? It believed that through yoga, the people can directly enter a mind of another individual, and maybe that was practiced for some hypnotic purpose, hypnotism, or for influencing, maybe for a positive way, for a positive cause. That is the mystery. So that is not directly cannot be analyzed by scientific statements. So these were the first 4 categories of the initial versions of yoga. And now I come back to the yoga and Indian national movement. During the Indian national movement in the late 19th century and early 20th century, the yoga somewhat got a spike. So how? There were some organizations, those, although they were really banned by the Britishers, the Anushilana Samiti, etc., they actually preached yoga. And in guys, they were doing a lot of anti-British movement. That were basically they have been doing a wonderful job in driving out the British or proposing a real a threat to the stability of the British government. So initially was that they projected that the yoga was for everyone, and in guys they were doing the anti-British movement or the Quit India movement. And now I come to the history of Ayurveda. The history of Ayurveda, basically, it was also has a religious origin, and it was believed that the Ayurveda was first proposed by Lord Brahma, then Yaksha Prajapati, and consequently the Ashwini Kumar as the twin gods, and they used to be called as the doctor gods, and then they were passed to the king Indra. So this is the phase where the Ayurveda was largely confined to the gods or the religious aspects. And now what Indra did, he passed his knowledge to 3 important persons. They are not God. They are Acharya Bharadwaj, Acharya Dhanvantari, and Acharya Kashyap. They were human beings, they were sages, they were saints, but they used to rigorously practice the medical medicines and surgeries and other medical aspects at that point of time. And now from gods to sages, so from gods to humans, there's a transfer of knowledge came by the virtue of Indra. And what happened later on? The medicine was that Ayurveda concept got really diverged into 2 parts. One is the medicine, which was pioneered by Atreya, the school of physicians or the Vaidyas between 8th and 6th century BC, and the Dhanvantari, the school of surgery. So the divergence took place straight away. Dhanvantari was the forerunner of all the surgeries between 9th to 6th century BC. And now in the 1st century, the Charaka was the proponent of the all Ayurvedic medicinal guide, and the Susruta Samhita was composed between 6th to 8th century. So this is the best cross history of Ayurveda. And now in the Middle Ages, though the Ayurvedic concept was somewhat subdued by those alchemies as well as the continuous onslaught of the Muslim invaders, and so the thing somewhat got subdued. Though later on, in the late Middle Ages, the Delhi Sultanate or the Mughals were somewhat patronizing, especially Akbar, were patronizing Ayurveda parallelly with the Unani form of medicine, because the Ayurveda and Unani were both somewhat similar, all based on herbs for the cure of ailments. Now, coming back to another late 19th century, the Pandit Dajipada Sastri, he was the first proponent of the Ayurvedic concept in later on. That is, his presence directly coincided with the nationalist movement, and he introduced the first magazine, Rajvaidya, that can be very much claimed as the first journal of Ayurveda in 1883, then Arya Vishak in 1888, and the first Ayurvedic Congress was set up in 1907. And coming back to West Bengal, we are having Kaviraj Jamini Bhushan Roy. He established Ashtanga Ayurveda Vidyalaya in 1960. The Calcutta Ayurvedic Institute of Pharmacy by Surendranath Goswami. And in Baroda also, the Sayajirao III, he established Sayajirao Ayurveda Vidyapith in 1906. And this is how this institute somewhat took place of what we now known as the MS University of Baroda. Anyway, so before relating Ayurveda with yoga, is very important to know what is the philosophy and what is the fundamentals of Ayurveda. So Ayurveda and the theory of biopoiesis. So what Ayurveda predicted regarding the origin of life is first the origin of biological monomers that led to the polymers, and finally the polymers gave rise to the cell. That has been stated in Ayurveda. And now the dictums, Nasto Vidya Bhavo, Na Bhavo Vidyate Satam. Non-existence cannot give rise to existence. That is, it is somewhat similar to the, I think, the cellular theory of biopoiesis is that omnicellular or celluli. Oh, okay, so what Ayurveda says, avyakta, that is invisible, gives rise to vyakta. So we can very much correlate that the monomers can join with one another to give to polymer and consequently the cell, which is later on visible. And these building blocks are absolutely present everywhere in the universe. And they categorize into three parts: the sattva, the rajas, the tamas. Sattva means the energy that is required for creation. Rajas is the movement pattern of particles. So unless they collide with one another, it is not possible for them to make a building block. And tamas, that inert material which is having the capacity to convert into new form. And this might well be correlated with a very old concept of the nucleic acid. Though nucleic acid is not inert, but they have a complementary. In the period during the ancient time, the origin of life, the nucleic acids were originally first built as a complementary particles, and then onwards the cell, and now what we know as this replication, transcription, translation, though is a part of the proteins. Okay, so the life began as invisible component, then passed through the intermediate stages to form the visible state, which we know as Mahabhuta, as per the Ayurvedic concept. Maha means the big, and Bhuta is the first form of existence. And these Mahabhutas are categorized into 5 types. That's Akasha, that is space and ether; Vayu, that is air; and Tejas, fire; up, that is water; and Prithvi, earth or soil. And they constitute all objects in the universe. And now the Ayurvedic concept of medicine is largely based on these 5 entities. Coming to the next slide, the Ayurvedic philosophy, the combination of 5 elements. That is, as in the previous slide, I showed there are 5 entities. These 5 entities combines to form 3 further forms. That is called Tridosha. Tridosha are they have 3. That is, Vata is a combination of space and air. Pitta, space and fire. Pitta is fire, and Kapha, water and earth. And Mahabharata Tridosha theory says that these 3 Tridosha symbolizes the physical, chemical, biological properties of a compound, and all the diseases, or even the healthy body, is either a balance or an imbalance of one of the 3 Tridosha. So when does the disease occur? If either of the 3 dosha or a number of 3 dosha goes out of his optimal concentration, or an imbalance occurs. So this is the Mahabhuta 3 dosha theory. Now, imbalance of dosha, if the vata, that is space and air, if there's an imbalance, diseases like diseases of large intestine, constipation, gases, and etc. occurs. And for the pittas, there are some digestive problems, small intestine, diarrhea, etc. And for kapha, disease of stomach. But most importantly, notably mucus condition, cold and cough, etc. are the symptoms. Now, how both of them are related? Ayurveda and yoga. This could be my final part of the lecture. Basically, both are 2 healing practices, but they have one goal. That is, make life healthier. Make life healthy. Okay, and basically, whatever may be the thing, they have a side effect. So, what is the side effect? Side effect is overall positivity, a healthy life, a happy mind, a tension free mind. These are the side effects of both of them. So they both share the same principle. Ayurveda, the resort to make changes and practice certain treatments that help in achieving harmony between doshas and nature. And yoga, various methods like practice of yasana, yeah, asana, help in quietening the mind. So Ayurveda basically relies on the use of herbs or oils, basically largely from a plant source that helps in maintaining balance in the body, and yoga through various practices of asana helps in quieting the mind and putting in unison with the nature. So there is another common thing, the prana, the life. Both are related to yoga and Ayurveda. In yoga, prana's mind that seeks for the higher evolutionary transformations, and Ayurveda, healing power which seeks to unite the living system. And both of them results in system of self-improvement. And I cite one of the examples, pranayama. Pranayama basically it's a controlled breathing, and it can be interpreted both with respect to yoga and Ayurveda. In yoga, you can say this connects consciousness, the mind, and the physical body. And Ayurveda is a physical part of thinking and thinking itself. So both has been mentioned. Pranayama can be interpreted with respect to both. And how does Ayurveda interprets? They say that once you have a dosha imbalance, if you have a controlled breathing, there might be some changes in the muscular tone that will eventually reflect in the nervous system and will cool down, or the tension of the nerves will ease out. And the same is also said in yoga, but maybe from a different form. So, as I once again said, they both have the same goal. The ultimate goal is to help you becoming healthier and a balanced version of yourself. So these are, I got two papers yesterday, and they both said that preliminary clinical evaluation of external Snehan. Snehan is an Ayurvedic oil treatment, and asanas in the patient of sciatica. Sciatica basically is a back pain, I think, the lower part of the body. And in this paper, it has been stated that the combination of asanas and Snehan therapy results in a better improvement of sciatica among some industrial workers. And this is another paper, a pilot feasibility study of the whole system of Ayurvedic medicine and yoga therapy for weight loss. So at present, there has been a lot of research that has been going on for both a combinational therapy of Ayurveda and yoga for cure of a lot of ailments. And believe me, it does work. It enhances, both of them fortifies one another. So thank you for being with me. I hope I did not linger too much.
Thank you. Thank you so much, Dr. Sinha, for your lucid explanation. It is very much interesting to us, but sorry that we have no time. Just it is our now. I request Dr. Mohapatra for next. Dr. Mohapatra, please.
Thank you, sir. After 4 brilliant scientific sessions, we have come to the end of this 2-day international webinar on yoga, the holistic approach to physiological and psychological homeostasis. We begin the valedictory session for the day. I request Dr. Rajendra Prasad De, Dr. De is presently Assistant Professor and head Department of Botany, Mohanpur Government College, and is also holding the post of Teachers Council Secretary. He has completed his graduation from Jhargram Raj College and post graduation from Vidyasagar University. He has also obtained his doctoral degree from Vidyasagar University. His research interests include taxonomy, ethnobotany, and biodiversity. He has several research papers, book chapters in national and international journals of repute. Besides, he is a regular writer in various common local papers. Thank you. Over to Dr. Day.
নমস্কার। নমস্কার, good evening, respected chairperson, our officer in charge, Dr. Nimaichan Masanto, honorable research persons, participants, my dear colleagues and beloved students. It gives me immense pleasure that the Department of Physiology, Government General Degree College, Mohanpur, has at last successfully organized the long-awaited 2 days international webinar on yoga, the holistic approach to physiological and psychological homeostasis. Am I audible?
Yes, sir. Yes,
Hello?
sir. Yes, sir. You are audible.
Okay. The present speaker is not an expert at all in this field, but tries to express his feelings on this practical method from its classical text in brief. Although it is claimed that Indian philosophy does not influence our society directly, there is no denying about the indirect impact of philosophy on our society. Though in our personal life, we follow Charvaka, at least like Javali of Ramayana. We have great and peculiar respect for Yoga Darsana, especially for hot yoga, like Ayurveda. Due to various stresses created by abnormal lifestyle in modern age, the Yoga Darsana is very much relevant today. People believe that these have miraculous power to solve their problems. Yoga is one of the 6 Astika philosophy in India. It is probably second most influential philosophy after Vedanta. These 3 ancient philosophies, Charvaka, Vedanta, and Yoga, are still living not only in India but throughout the world. Patanjali collected and compiled the main thoughts of yoga, which is obviously present earlier in his Yoga Sutra, the basic book of this philosophy, probably 1 or 2 centuries before Christian era. Yoga is a Vedic word, denotes the yoke of oxen or horses drawing a car in the Atharva Veda and the Brihadaranyaka Upanishad. The term yoga implies different meaning in Sanskrit. Literally, it means connection. In mathematics, it means addition. In Ayurveda, it means formulation. In Bhagavad Gita, it has very complicated meanings. In philosophy, it is different but probably come from Bhagavad Gita but in strict sense. Bhagavad Gita define yoga as yoga karmasya kausalam, that is method, technique or skill to do work. Patanjali defines yoga as yogas chitta vritti nirodha. Swami Vivekananda translated it as yoga is restraining the mind stuff from taking various forms when man rests in his own state. If anyone wants to do so, he may follow the instructions of Patanjali. Yagnavalkya in Yoga Yagnavalkya, one of the oldest treatises of Hatha Yoga, defines it as Sangyoga Yoga iti ukta jivatma paramatmana. Yoga is the method to connect the soul of living being to the soul of infinity. Patanjali mentions various obstructions of yoga. These are Badhi, Stana, Sangsaya, Pamada, Lasya, Virati, Bhanti, Darsanalabdha, Bhumikattana, Avasthitatani, Chitta Viksepas, Te Antaraya. Disease, mental laziness, doubt, lack of enthusiasm, lethargy, clinging to sense enjoyment, false perception, non attaining concentration, and falling away from the state when obtained are the obstructing distractions. His advice to overcome these obstructions in this way: Maitri, Koruna, Mudito Peksanang, Sukha Dukha Punna Punna Visayanang, Bhavanas Chitra Prasadanam. Friendship, mercy, gladness, and indifference being thought of in regard to subject, happy, unhappy, good, and evil, respectively, specify the chitta. Yoganganusthanad asuddhi skaye jnana dipti aviveka ksatah. By the practice of different parts of yoga, the impurities being destroyed, knowledge becomes egulgent up to discrimination. These parts are yama, niyamasana, pranayama, pratyahara, dharana, dhyana, samadhaya, astavangani. The first step is yama. Ahimsa, satya, steya, brahmacharya, parigraha, yama. Ahimsa, truthfulness, non-stealing, brahmacharya, and non-receiving are called yama. Ete de jati desha kala samayana vichhinna sarvabhauma mahavratam. These rules are universal, independent of nation, community, time, and situation. Most people who find peace through yoga are eliminated in this step. Without yama, no one is eligible in yoga. Now, the second step, niyama. Saucha, santosha, tapaha, sadhaya, saraponidhanina, niyama. Hygiene, satisfaction, mortification, study, and knowledge of eternity are the niyamas. It is again very hurdle task for money hoppers who realize the goal of persons in is personal satisfaction of wants and a higher standard of living as measured by possession of commodities, and invite a series of physical, psychological, and social problems in life. People of consumerist society understand yoga means asana, pranayama, and dhyana or meditation. From here, a branch of yoga was evolved called Hatha Yoga. But Hatha Yoga cannot completely separable from Yoga Patanjali. They are closely related to each other. Swami Vivekananda stated that the next step is asana, posture. A series of exercise, physical and mental, is to be gone through every day until certain higher states are reached. This portion of the yoga is a little similar to the Hatha Yoga, which deals entirely with the physical body, its aim being to make the physical body very strong. We have nothing to do with it here because its practice are very difficult and cannot be learned in a day, and after all do not lead to much spiritual good. The object in these is physical, not psychological. The result of this branch of yoga is to make men long live. Health is the chief idea, the one goal of the Hatha Yogi. The origin of Hatha Yoga is uncertain, but may be present in prehistoric time. It is mostly elaborated by Natha Yogis because all later works of this subject are compiled by them. The Gherendo Sangita says, Adiswaraya Pranamami Tasmai Yena Padistha Hatha Yoga Vidya. In Hatha Yoga Pradipika says, See Adinathaya Namastu Tasmai Yena Jena Padistha Hatha Yoga Vidya or Hatha Vidya Hi Matsendra Gorakshadya Vijanate. Swatmaram Athoba Yogi Janite Tat Prasadatah. So Natha community had much contribution to yoga. The activities of Hatha Yoga were very confidential. Hatha Yoga Padipika says, Hatha Vidya Parangupta Yogina Siddhimichata Bhaved Virjavati Gupta Nirvidya tu Prakasita. Or in Shiva Samhita, Yoni Mudra Parangupta Nadeya Jaishakasyachit Sarvatha Naiva Databba Panakantha Gatairapi. And a number of symbolic terms were used like Ira, Pingala, Susumna, Kundalini, Muladhara, Swadhisthana, Manipura, Anahata, Visuddha, Ajna Chakra, Sahasrara, etc. These are not human anatomical structures but have some secret meaning. Hidiyasti Pankajang Digbang Dibbalingena Bhusitam Kadi Thantak Saropetang Gadasaran Susobhitang. Inside the chest of all organisms, a beautiful divine lotus with 12 petals are present. Each petal marked Ka to Tha very beautifully. It is called Anahata Kamala. What is its meaning? It has some secret meaning but cannot be understood by the knowledge of human anatomy. Many mudras, such as Bajoli Mudra, Amaroli Mudra, and Sahajoli Mudra, are directly involved with sexual activities. The yoga, which is popular among people, is Hatha Yoga for physical fitness, but according to Swami Vivekananda, it is very difficult task. It may be easier or difficult, but the number of criteria of yama, niyama, etc. are not decreased but increased. Patanjali mentioned only 5 in each, but it is double in the case of Hatha Yoga. Ahimsa Sattamasteya Brahmacharyang Dayarjavam Samadhitir Mitahara. Like that. Sorry, load shedding is there.
No problem, sir.
Sir, you may off your video, sir. Sir, video ta off korte paren. Sir, video. You may off your video.
Okay.
Only audio. Okay, sir. Okay.
Okay.
You can proceed.
Huh.
Rajan Babu, you can proceed.
Okay. Swami Vivekananda, says it is very difficult task. It may be easier or difficult, but the number of criteria of yama, niyama, etc. are not decreased but increased. Patanjali mentioned only 5 in each, but it is double in the case of Hatha Yoga. Ahimsa Sattam Astyang Brahmacharyang Dayarjavam Samadhiti Mitahara Saucha tu ete yama dasa Karmana Manasa Vacha Sarvabhutesu Sarvada. Always non-violence, charity, etc. to all organisms in activity, mentally and vocally is very important. Like a selfish, bypassing these basic steps, practices of yoga to increase only lifespan is not possible. Stages of Hatha Yoga are Sodhana, Asana, Mudra, Pratyahara, Pranayama, Dhyana, and Samadhi. These are further subdivided into innumerable types. Yajnavalkya in Yoga Jagnavalkya mention good asana or postures are only 8. Among them, only 3 are best. It mentions names of 8 asanas like swastikang gomukhang paddam virang singhasanam tatha bhadrang muktasanam chaiva moyasanam evacha. The number increased up to 32 in Gheranda Samhita. According to Gheranda Samhita, the number of asanas is innumerable, but the human 32 is suitable. It mentions their activity to cure diseases like Atad Badhi Samunasana Karam Padmasanang Chochate or Bhadrasanang Bhavedetad Sarva Badhi Vinasanam and so on. Ayurveda is silent about yoga, though Charaka says about exercises as Soriro Chesta Ya Chesta Sthoyatha Balavardini Deha Vyama Sankhata Matrayatang Acharet Laghavan Karma Samarthang Stharyang Klesha Sahisnuta Dosokhayo Agnividhischa Vyamadupajayate Samaha Tamaha Krishna Raktapittang Patamakaha Uti Vyamatah Kasa Jara Chaddi Jayate. That is, physical activities to increase physical fitness are called exercise. It should be done in limited manner. It increases patience, ability to work, digestive power, loss of obesity, and decrease physical problems. But excessive exercise causes tiredness, fatigue, physical decay, dehydration, and various diseases. If yoga is considered one kind of exercise, it has same beneficial or harmful effects and should be practiced only under supervision of experts. Dattatreya, in his Yoga Rahasyam, mentions several harmful effects of yogas done by inappropriate manner, such as deafness, paralysis, speechless, loss of memory, blindness, and fever. Badhijang yarata lopaha smiter mukatnam andhata yarascha jayate saddha ajnanata yoginah. Before I finish, I recall a song of our great philosopher Rabindranath Tagore. বিশ্ব সাথে যোগে যেথায় বিহারো সেইখানে যোগ তোমার সাথে আমারও নয়কো বনে নয় বিজনে নয়কো আমার আপন মনে সবার যেথায় আপন তুমি হে প্রিয় সেথায় প্রিয় আমারও থ্যাংক ইউ এভরিবডি
Thanks a lot.
Thank you, sir. Thank you very much for beautifully explaining the various forms of yoga. This is to be mentioned that Acharya comes from the term achar, meaning behavior or deportment. The term Acharya thus refers to the person whose behavior and deportment should always be followed by everyone. Acharya Brahmdev Ji has set an excellent example of a true Acharya to all of us in this 2-day international webinar. He has made himself available for the entire sessions for both the days. After completion of his lecture, he has always been there silently teaching us the most important lessons of life that we should all follow. The lessons of humbleness, perseverance, and patience. He has encouraged us and inspired us with his presence all through the webinar. We would not have had a better example of an Acharya with us. With this, I request humbly Acharya Brahmdev Ji to kindly say a few words.
Can you hear me, please?
Yes, sir, we can hear you.
That's audible, perfect. Okay, namaste, everybody. Welcome back. That was both a learning curve for me and for everybody who joined in this webinar. We've always been taught in the methodology of the Vedic studies, it's sunana. So first listen and then allow people to listen to you. That was my philosophy throughout this lecture. A few good things which I could relate is learning from the expertise of each and every speaker intervening in there, and each of them, I could say, boil down to one thing: creating the sound balance between body, mind, and spirit, which eventually would enable us to be real human social beings within the community and the world at large in the real terms of Vasudhaiv Kutumbakam, the world as one family. Unfortunately, talking of globalization since the last probably 25, 30 years, it's been only on the basis of economical exchange. It was a transactional globalization. And to meet an effective and efficient globalization, the basics of yoga, especially yam niyam, would create that true human spirit within us where we can join with each other. That is another definition of yoga: joining, uniting, yoking. We'll be joining each and every individual on the common basis of that we share the universal common living values of yoga. That is good. And from the health point of view, be it physical health, mental health, moral, spiritual, and social health, that also yoga would bring us on one single platform where there won't be any divergence or any division among us. So the yoga is the science given to us by the rishis. I said in my lecture, they were the scientists of human philosophy. They unfolded the science from the Vedas to us and brought it down in simple form for physical, mental, moral, spiritual, and social upliftment of all, irrespective of the color, race, or any other physical divide which man has created. And probably these divides stand now larger than the Great Wall of China. If you want to bring those divides down and bring humanity under one roof, yoga would be one. And starting with bringing the internal and external balance within ourselves, we become better individuals within our family unit. Remember, the smallest unit of society or this world is the individual. So everything starts with me, then emulated by my friends and relatives around me. That becomes a community at the smaller level. Growing to the macro level, it becomes the village, the town, the city, the country, and the world at large. So I think let's continue to draw inspiration from the yoga philosophy and bring that concept of Vasudhaiv Kutumbakam in real terms, in human terms, and realize that. Wish you all the best. Thanks for the opportunity to be in your midst, and thanks to all the panelists and the organization for having given me the opportunity to be here. Thank you. Dhanyavad.
Thank you, sir. Pranam on behalf of the organizing committee. Now, I would like to request our patron and officer in charge, Mohanpur Government College, Dr. Mashanto, to kindly say a few words.
Good evening, everybody. First of all, I am very grateful to meet with the uh, lecturers, the scientists, and other dignitaries whose lectures enlightened me as well as our all viewers. Yoga, actually, the concept of yoga, the benefits of yoga on human health, it has been studied, uh, practiced from ancient times, but uh, its effects on human body has been studied elaborately all over the world, and also so many scientists nowadays, some of them who has participated in our webinar, they have explained in very lucid manner. Actually, I have been reformed, I have been enriched with sharing their knowledge with us. And I think if the outcome of our webinar, if we spread it to our society, to the learners, I think the webinar would be grand success. So again, I convey my gratitude, my thanks to all the dignitaries participated in this webinar, as well as lastly to our faculties, to our organizing committee for their endless effort. Without them, the webinar cannot be happened, cannot be a success. So I again grateful to him, to them. Thanks a lot. Be safe, be healthy. Shubho Sharodiya. Thank you all.
Thank you, sir. I now request our convener and head of the Department of Physiology, Sri Proshenjit Chaudhuri, to kindly address the session with vote of thanks.
Thank you, Dr. Dakshani. Am I audible and visible?
Yes,
Yes.
sir.
Okay. Our patron and our honorable OIC, Dr. Nimaichand Mashanta sir, teacher in charge, Dr. Rajendra Prasad De sir, respected Acharya ji, our honorable speakers and chairperson, respected audiences and dear students. Now we are at the end of 2 days international webinar, Yoga, the Holistic Approach to Physiological and Psychological Homeostasis. Thus, as a convener, I have to deliver a vote of thanks. But in some occasion, you may realize that Brahma is helping you and he is coming in front of you in many forms. My situation is like that. I am an ordinary teacher without any bright salutation and teach in a college situated in one of the remotest corner of West Bengal. I never thought that so many elegant delegates may join with us and we can organize such a vibrant webinar. But it has happened. It would not be possible without the kripa of Brahma. To me, Saguna Brahma is Sri Ramakrishna Paramhansa. I have nothing to offer Thakur. I am only the receiver, and last 2 days I am receiving his kripa as usual. This webinar is special to me, not only for my personal reason, but also it is very significant in many aspects. First of all, it is not a subjective webinar. What we actually in maximum times we see. Rather, it is an objective webinar. Our honorable speakers from various disciplines enriched us about yoga. Secondly, a great problem with scientific researchers is that we have very little knowledge about social sciences. On the other hand, academic persons are not very much aware about spirituality or practitioners who are practically apply those. In these webinars, researchers, academicians, and spiritual persons all came together. Finally, usually maximum scientific talk, which occur in many webinars, has no direct effect in society. But in our webinar, I can proud about that. Every lecture has a direct social applications. Yesterday, first of all, Acharya Brahmadevji enlightened us lucidly about the facts of Patanjali Yoga Sutram and Ashtanga Pada. He also told us how can we use them in our daily life. Dr. Montu Shah shows us series of scientific findings about the effect of yoga. He also gave us an idea how does these facts can be used in COVID crisis and in other problems of our society. Mr. Abhishek Chakraborty explained elaborately about role of yoga in aging. Professor Pratiti Ghoshman gave us an in-depth concept about different types of yogic practices and their effects on maintaining physiological homeostasis. Dr. Ekta Madam discussed about her findings in the effect of yoga on cardiorespiratory system. She also informed us about the use of yoga in treating patients with chronic cardiorespiratory diseases. Dr. Kuntal Ghosh gave us theoretical as well as practical concepts about meditation. Today as well, in morning, Dr. Avdishji nicely described how yoga can be used as a tool for global peace and harmony. Dr. Sharup Prasad Ghosh enlightened us about Swami Vivekananda's concept of practical Vedanta. Dr. Rajiv Chaudhary told us about the scientific basis of pranayama and its application. Dr. Pallav Sengupta described nicely about male reproductive health and body-mind bridging. Dr. Shulokna Datta told about the relationship between yoga and pregnancy and underlying neuroimmune endocrine care. Thus, I would like to thank all of our eminent speakers for enriching us. This webinar would not be possible without active support and inspiration of our patron, YC Dr. Nimaichand Mashanta Sir. Sir was always actively and actively guided and supported us. Then I have to say that we could not do anything, or we could not arrange such kind of vibrant webinar without the help of Physical Education Foundation of India. They not only help us in various ways, for like connecting with eminent speakers and others, they have spread this webinar, the news of this webinar throughout the India, and from the very farthest corner from India, many persons contacted with us to join this webinar. I would specially thank Dr. Piyush Jainji, National Secretary PEFI, and Dr. Sudarshan Vishwas, President PEFI West Bengal Chapter, and Associate Professor Vishwabharati University, Dr. Krishnendu Pradhan, Vice President of PEFI WB Chapter, who was literally one call away from us always throughout the last 1 month. Actually, I would like to thank Dr. Debaprasad Shau, Secretary PEFI West Bengal Chapter and Associate Professor Mohishadol Girls College, for his continuous advice and support. Then I would like to extend my sincere gratitude to our esteemed chairperson, who had been kind enough to accept our last minute invitation, Dr. Tuhin Shubhro Banerjee. I would like to thank our Honorable TIC, Dr. Rajendra Prasad De, for his constant support and guidance. I also would like to thank our esteemed faculties and dear students of Government General Degree College, Mohanpur, for their active participation. Then I would like to thank all of our participants. Since the success of any seminar or webinar depends on the participants, and hence I take this opportunity to thank all the participants, without whose active involvement we would not have reached the pinnacle of success. Finally, my colleague and sister, also organizing secretary of this webinar, Dr. Dakshayani Mohapatra. Actually, I don't know how to thank her. She was a vital force in yogic term Shakti of this webinar. I have just supported her. So I have nothing but silence wish from the bottom of my heart for her happy and prosperous future. Now, I would like to share some photographs of our college and Mohanpur to all of you. Okay. Okay, presentation is visible.
Yes, sir.
Presentation is visible.
Yes, sir.
Okay, thank you. Okay, this is our college, Government General Degree College, Mohanpur, Paschim Medinipur. It is a rural college. You can see it. This is our college. Last year, before Durga Puja, this year is COVID condition. Our OIC sir, in Teachers Day, our TCS, Dr. Rajendra Prasad Day, our students, some of our faculties, all are not here. This is our NSS, Government General Degree College, Mohanpur, our NSS students. They are in Mohanpur Brahmin Mela. This is Jagannath Temple, ancient Jagannath Temple of Mohanpur. This Jagannath Temple, Mohanpur. This is another old temple of Mohanpur, Lolar Chondi Temple. This is the Devi Lolar Chondi deity. This is one of the most favorite area of Mohanpur to me, Ramakrishna Ashram Mohanpur. This is annual festival at Ramakrishna Ashram Mohanpur. Khichudi, Bhog. This is another picture from that festival. This is the Holy Trinity of Ramakrishna Ashram. And last of all, namaskar to everybody. Thank you for remain associated with us throughout 2 days. At the end, I would like to chant Shanti mantra. Om Sarve Bhavantu Sukhinaha Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kaschit Dukha Bhag Bhavet. Om Shanti Shanti Shanti. Thank you all.
Thank you. Thank you.
Thank you, sir. I request OIC sir to kindly end the session and declare the session closed.
Okay, again, with profound appreciation and thanks, I like to announce the end of session, end of this 2 days webinar. সবাই ভালো থাকুন, ভালো করে পুজো কাটান, সবাইকে আগাম শারদীয়ার শুভেচ্ছা নমস্কার জানিয়ে শেষ করছি।
Thank you.
Thank you. Streaming off করছি। stream off।
ইনি বোধহয় কিছু বলতে চান।
পল্লব আছিস?
না, পল্লবদা বেরিয়ে গেছে।
সুলগ না আছিস তোরা? স্ট্রিমিং বন্ধ করেছিস তো? কেন? বন্ধ করে দিস।